1. Which of the following is the primary role of a group fitness instructor? A. Design individualized workout plans for members. B. Motivate participants and ensure a safe and effective workout environment. C. Prescribe medical treatments for injuries. D. Diagnose chronic diseases. 2. When cueing a movement to a class, which method is most effective? A. Use complex terminology to sound professional. B. Use clear, concise verbal cues combined with visual demonstration. C. Give cues only at the beginning of the session. D. Avoid verbal cues and let participants figure out the moves. 3. What is the recommended target heart rate zone for improving cardiovascular fitness in most adults? A. 30 to 40% of maximum heart rate. B. 50 to 85% of maximum heart rate. C. 90 to 100% of maximum heart rate. D. 10 to 25% of maximum heart rate. 4. Which exercise modification would be most appropriate for a participant experiencing lower back pain during a group fitness class? A. Increase the speed and intensity of movements. B. Avoid exercises involving spinal flexion and encourage core stabilization. C. Encourage deep twisting motions. D. Perform high-impact jumping exercises. 5. The concept of progressive overload is essential in exercise programming because it decreases training intensity over time. B. Ensures continuous adaptation by gradually increasing the demands on the body. C. Involves only stretching exercises. D. Focuses exclusively on rest days. 6. Which of the following is a contraindication to participation in a group fitness class? A. Controlled hypertension. B. Acute injury or illness. C. Previous history of exercise. D. Being a beginner. 7. What is the most effective way to manage class safety in a group fitness setting? A. Ignore participants' feedback during class. B. Monitor participant form and provide appropriate modifications. C. Allow participants to do any movements without supervision. D. Focus only on completing the planned routine. 8. What type of group fitness class is most appropriate for a participant who is a beginner and wants to improve balance and flexibility? A. High-intensity interval training, or HIIT. B. Step aerobics. C. Yoga or Pilates. D. Plyometric training. 9. When teaching a dance-based group fitness class, what is the most important aspect to consider? A. Use very fast music to increase calorie burn. B. Ensure the choreography matches the musical rhythm and is easy to follow. C. Avoid giving modifications to participants. D. Focus only on advanced steps. 10. Which of the following best describes dynamic stretching? A. Stretching performed in a stationary position without movement. B. Controlled movements that gently take joints through their full range of motion. C. Holding a stretch for 30 seconds or more. D. Stretching after a workout only. 11. The talk test is a simple method used to A. Measure participants' VO2 max. B. Assess exercise intensity based on the ability to speak comfortably. C. Monitor blood pressure during exercise. D. Determine hydration status. 12. Which of the following is an example of an open chain exercise? A. Squat. B. Leg press. C. Bicep curl. D. Wall sit. 13. What is the main reason for incorporating a cool-down phase after a group fitness class? A. To increase heart rate rapidly. B. To gradually return the body to resting state and reduce muscle soreness. C. To start stretching muscles aggressively. D. To immediately increase flexibility. 14. When instructing participants, how should the instructor prioritize cueing during an exercise? A. Safety and proper form cues first, then motivational cues. B. Only motivational cues. C. Ignore form cues and focus on intensity. D. Only count repetitions. 15. Which of the following is a benefit of cross-training in group fitness programming? A. Increases the risk of repetitive injury. B. Promotes balanced muscle development and reduces overuse injuries. C. Focuses exclusively on one muscle group. D. Limits variety and adaptation. 16. What is the most appropriate hydration advice for participants during a 60-minute group fitness class? A. Avoid drinking water to prevent cramps. B. Drink small amounts of water regularly throughout the session. C. Only drink water before class. D. Drink sugary sports drinks only. 17. Which of the following describes an isometric muscle contraction? A. Muscle lengthens while contracting. B. Muscle shortens during contraction. C. Muscle length remains the same while contracting. D. Muscle alternates between lengthening and shortening. 18. For which population should group fitness instructors be especially cautious and possibly refer to a healthcare provider before participation? A. Healthy adults under 30 years old. B. Pregnant women and older adults with chronic conditions. C. Regular exercisers with no symptoms. D. Teen athletes. 19. What is the primary energy system used during a 30-second sprint interval? A. Aerobic system. B. Phosphagen, or ATPPC, system. C. Oxidative phosphorylation. D. Glycolysis only. 20. What is the best strategy to encourage participant adherence in a group fitness program? A. Use punishment for missed classes. B. Foster a positive, inclusive environment and set realistic goals. C. Keep communication minimal. D. Focus on competition only. 21. Which of the following is not a characteristic of high-intensity interval training, or HIIT? A. Alternating periods of intense effort with recovery. B. Consistent moderate effort throughout the session. C. Improved cardiovascular fitness and calorie burn. D. Typically shorter total workout duration. 22. What is the recommended recovery time between sets for muscular endurance training? A. 5 to 10 minutes. B. 30 seconds to 1 minute. C. 3 to 5 minutes. D. No rest. 23. Which of the following best describes the neutral spine position? A. Excessive lumbar arch. B. Flattened lower back against the floor. C. Natural curvature of the spine maintained without excessive flexion or extension. D. Hyperextended cervical spine. 24. What is the best way to accommodate participants with limited range of motion in a group fitness class? A. Exclude them from exercises requiring full range of motion. B. Provide modifications and encourage gradual improvement within comfort. C. Push them to perform the full movement regardless of discomfort. D. Avoid any flexibility work. 25. Which of the following would be an example of a multi-joint, or compound, exercise? A. Bicep curl. B. Leg extension. C. Squat. D. Wrist curl. American Council on Exercise. The American Council on Exercise, or ACE, Group Fitness Instructor Certification Test evaluates candidates on their ability to design, lead, and motivate safe and effective group fitness classes. The exam covers exercise science fundamentals, class programming, teaching techniques, music selection, and safety protocols. It also emphasizes the ACE ramp approach, respect, recognition, alignment, mistakes, and participant engagement to create a positive environment. The test consists of 150 multiple-choice questions and requires knowledge of anatomy, physiology, exercise techniques, and group dynamics. Passing this exam certifies instructors to lead diverse classes, from cardio and strength training to yoga and high-intensity interval training, or HIIT, ensuring professional competency and participant safety. Here are the top 5 beneficial uses of ACE exam. 1. Professional credibility. ACE certification demonstrates expertise in fitness training, boosting trust with clients and employers. 2. Career advancement. Certified professionals have better access to job opportunities, promotions, and higher earning potential in the health and fitness industry. 3. Knowledge validation. The certification confirms mastery of exercise science, program design, and client safety protocols. 4. Client confidence. Being ACE certified reassures clients that trainers follow industry standards and ethical practices. 5. Continuing education. Certification encourages ongoing learning to keep up with the latest fitness trends and research.